So, Mr. Prasad, welcome to the show. And
Thank you.
as someone from the professional sports industry, you probably understand better than anybody else how most people, how important the spine is, especially in sports. Injuries can happen. What's your take on that?
Oh my God, please, I'm telling you, it's not going to be easy at all. Any sort of an injury, especially the spine, and which wicket keepers, fast bowlers, they go through a lot of the spine issues, especially the lower back. So it's not going to be easy, and for them to come back to the main fold, it takes several months. So, it can probably ruin someone's career as well if it's not treated well, if it's not handled with care, compassion, and proper treatment. And that's extremely important. So, I've seen many of them who have, lost their path in their careers because of injuries.
Absolutely. I think that nobody knows better than you.
Well, luckily, I didn't have any spine-related injuries. Yes, I did have a labrum tear in my shoulder, right shoulder, my bowling arm. That itself took, say, about 6 to 8 months for me to come back. I mean, I'm talking about late 90s, and India was not prepared for it, for any sort of advanced mechanism as far as the treatment is concerned. So I had to fly down to Australia, then spent a lot of time there, worked on my technique, worked on my injury, and the rehabilitation took a long time. So I think things have changed now. It is great that technology has advanced and we have embraced the technology really well. And now I think probably India is as good as any other country, any other Western country.
I perfectly agree.
Yeah.
I couldn't agree more. And that's why nowadays I think with changes in technology and me specifically asking you these questions is because I'm a spine surgeon. And for me, even we see a lot of patients who come with these kind of spine injuries. And, it makes a lot of difference how you rehabilitate after that.
Absolutely. But tell me, doctor, what makes the Mazor X Robot such a big step forward?
So I think it's taking a cue from the previous answer, whatever you told. So recovery from spine surgery is very, very important. And people fear spine surgery whenever they say that somebody's got a spine problem or a disc prolapse or even a simple back pain for that matter. Of course, the initial treatment is never surgery. We always try conservative treatment, exercises, physiotherapy, most of the things like any spine injury in sports as well. So there's a period of rehabilitation that is necessary before they can actually get back. But whenever we say that, people have a fear in their minds that spine surgery is not safe. So it's not like the robot is actually doing the surgery. We are the people who are actually controlling the robot and it's doing the surgery. But this particular robot is one of the state-of-the-art robot that we have recently got now. And specifically for spine surgeries, it takes that surgery to the next level of precision and accuracy.
Wow.
So we are getting that sub-millimeter accuracy, especially when we are doing these kind of surgeries, and we can do that in a minimally invasive fashion.
Fantastic. So in simple terms, it's like having GPS navigation during surgery.
Absolutely. So that's what we tell the patients as well. They can't understand what the robot is doing. So when you say that it's something like GPS, like a car has got all those technology in it, but then when you drive that car, you need somebody behind that. And we are able to achieve that better. Nowadays, you can't drive without GPS. You don't need to remember. So it takes the effort out of doing the surgery.
Absolutely. And so from a patient perspective, what changes?
So I say the most important thing is outcomes. It's not like the surgery is changing. The surgery is the same surgery, but we are performing the surgery in a much better way, faster way, which can lead to better outcomes. In terms of we are able to do these kind of surgeries with smaller incisions, minimally invasive surgeries. So patients can rehabilitate faster. In fact, patients can get back to their normal work faster. They can start sitting, standing immediately after surgery the next day, and they can get discharged faster.
Wow.
So the outcomes is what matters.
Fantastic. So my next question is that recovery aspect must be huge for active people.
Absolutely. So which is why gone are the days where patients needed spine surgery and they needed a big prolonged bed rest and needed to be lying down and doing a lot of So those days are gone now. People want to get back to their life faster. They want to get back to active life faster. So this is what they want. When can I get back to work? These are the questions they ask us. So we tell that with these kind of surgeries, when we are doing with the help of the robot technology, minimally invasive surgery, they can do that. We can help them achieve their goals faster.
Yes, exactly. It's very important for them to get back on their feet as soon as possible, isn't it? Yeah. And personally for you, what does today mean?
So today marks a very, very important landmark event as far as Aster CMI is concerned, as far as we as the Department of Neurosciences is also concerned. And personally for me also, this spine robot, I think we can do wonders, or we can take spine surgery to the next level. And with the combination of our team effort, where we can do our expertise, which is minimally invasive spine surgery, with the help of this robotic Mazor X technology, I think we can give the patients that cutting edge care, next level care of advanced spinal surgeries.
Fantastic, doctor. Congratulations. At the end of the day, technology is meaningful only when it improves human lives. And that is exactly what we hope to achieve with this new era of robotic spine surgery. Thank you very much, doctor.
Thank you. Thank you very much.